I'm a hepatobiliary surgeon based in Cleveland Clinic, Florida. It's a way to make the anatomy during surgery much easier for a surgeon. So we inject, usually inject a dye which is very innocuous, and using special filters intraoperatively, we are able to demonstrate the anatomy and the pathology in fluorescent color, which helps us guide us in surgery and shows us the terrain or the anatomy which is necessary. So we can avoid injuries, or in other ways, we can look better. I perform cholecystectomy, which is gallbladder surgery, which is one of my bread and butter surgery as an HPB surgeon. I try to perform cholecystectomy in almost 100% of cases with fluorescence imaging. We inject this dye called ICG dye, which is injected before the surgery, half an hour to an hour before the surgery. And then intraoperatively, using special filters and infrared light, we are able to demonstrate the biliary anatomy in this light with fluorescent color. Now, the whole advantage is, even though I know where I'm operating and I know the anatomy, it just gives me a better vision. So in case there's a problem, I can avoid those difficult areas with this dye and imaging. I think the main benefit from a patient perspective is you can feel that surgeons will be doing a much safer and more efficient procedure. There has been a lot of evidence coming up that it not only improves efficiency, but it also can improve the short-term and hopefully the long-term outcome as well. I use fluorescence in different kind of surgeries. One of the common ones where I use it is during my laparoscopic cholecystectomy. I also use it during laparoscopic liver surgery or even open liver surgery. And essentially, the reasons I use is first to demonstrate the anatomy, so it gives me a better idea of the whole anatomy, so I think of it as an accessory tool. And second, it can also demonstrate pathology in some cases, which may not be very clear intraoperatively. I think like anything else, they have to try it to get convinced, but they need to come to different societies, especially the symposium which we have in Florida every year in February. It has really taken shape. It used to be half a day, now it's like 1.5 days. World experts who are using this technique, they come and talk about it. The other way is they can always look up some videos, online videos, to see what can they achieve using fluorescence image guided surgery. Any new technique is met with a lot of challenge, or challenges I may say. One of the most common challenge I came across was people being unaware. They would question, why are we using this? And then the availability of technology. So if the technology wasn't available, most people would like to take the easier route and not use it. But I think sometimes you have to be an advocate for the patients, and as a surgeon, you have to push for the technology so it's easily available for, not for yourself, but for other surgeons as well. I think it has to be multifaceted. So the industries have to chip in. The surgeons have to convince other surgeons by presenting their work in meetings, and then convincing other surgeons what can be achieved by using this technique. And then we need some leaders like the chairs of the program in any hospital to talk to their managers to make this available in each hospital. So it becomes a routine rather than just experimental.